Hi everyone. So today I'm going live with Dr. Kiran. I'm going live with Dr. Kiran Kaur Sethi, and the topic of the day which she decided was aesthetics. When is it too much? When to stop? When to do what? Non-surgical, surgical, and how to decide. It's aesthetics, and let's see. I've just taken her invite. Hi, Dr. Kiran. How are you doing?
Hi, how are you?
I'm doing great. I'm doing great. How are you?
I'm good. How's it going? This is
It's
fun.
it's amazing. It's great. Things are getting back on track. Corona is subdued. Hopefully, fingers crossed.
I hope so. I hope
Yeah.
so, but I'm prepared. I'm prepared.
Yes. Hoping for the best, though.
Absolutely, absolutely. So I'm so glad to be doing this. So everybody, I'm
Yeah.
so glad to be doing this. Thank you so much for having me, Doc. We've been planning this for ages. But
Yeah.
today's Time is the perfect time because what we wanted to talk about, Doc and I were talking about this, like, okay, when do you go for surgery and when do you come to someone like me? And when do either of us say no? Right? So
Yeah. Yeah.
we want to talk about under eyes, we want to talk about noses, we wanted to talk about we talked about breasts and body contouring. These are the four biggies, right? So let's get
Great.
started. Dr. Rajat, tell me, when you have under eyes, for me, when I have an under eye tear trough that comes to me, if there's a
Yeah.
hollow, great, fill it. But if there's a really bad eye bag, then I know I can only improve it so much. And then I usually refer to you or someone like you, right? So,
Yeah.
or you, actually. So, but then my patient's always so scared about surgery. So, Dr. Rajat, I want you to tell me and tell everyone here one, why is it better for, well, why am I saying that, right? You'll explain it much better. Why is it better to come to you for an ear eye bag? And what is the downtime? Because people are so scared. The moment they hear about plastic surgery, they're really nervous about it. But I feel like you'll explain best is the downtime about the downtime and what they can expect.
Sure. So that's a great dilemma, which a big dilemma which a lot of patients have. They have eye bags, they have tear trough, whether to fill tear trough with fillers and conceal the eye bags and camouflage them. And that can certainly be done for mild to moderate cases. But once it crosses moderate kind of eye bags, whatever fillers you may do, they'll not camouflage the eye bags completely. Mind you, fillers do not treat eye bags, they just camouflage them. So if someone has moderate to severe eye bags, then they need surgical help. Or if someone wants a permanent kind of treatment, remember fillers don't last more than 1.5 years to the max, then they would need a surgery. Now, yes, a lot of people have this apprehension about surgery, whether it will go right, whether it will go wrong. So choose a good plastic surgeon, a board-certified plastic surgeon, see the results, and then decide. The downtime of the surgeries is there. 10 to 12 days is a downtime. You will have good amount of swelling and bruising around your eyes. It will look like that someone has punched you, but you are physically fine from next day. So like I did a blepharoplasty on my parents. They did the OPD the same day evening, right? So it's not that you are physically restricted, but yes, you are socially restricted because of the swelling and bruising.
That's great to know, right? So that's the concern. So if so it's not so guys, for those of you that have had under eye fillers done, then the bruising from an under eye filler is usually minor and small, right? And you cover it up with makeup. Bruising from a blepharoplasty, it's not the same. It's more severe, but you have a permanent result, correct? And what happens? How is the longevity of a blepharoplasty? Like, what do we watch out for?
So we do say it's permanent, but you see, Dr. Kiran, we all know is that nothing is permanent. Aging is a continuous process. Someone is 40, they're looking at 45, 50, 55. So the aging, you can't stop aging. Having said that, the result easily lasts up to 7 to 10 years. But it also depends upon your genetics, your lifestyle habits, sleeping habits, smoking. You see, there are a lot of things which goes into play on how someone ages.
Absolutely. And we can fill on top. So say there's a little bit of a hollow that develops, 10 years down the line, you can just fill it right on top,
Of
right?
course, of course, of course, yes, of course, yes.
So it doesn't preclude you from doing non-invasive options as well, right?
No, not at all. Not at all. In fact, I always tell them that you would need some or the other touch up, say 7, 10 years down the line, to maintain that look.
That makes sense. That makes sense because you can't stop the downward flow of the face, right? All the
The
bone was.
gravity, the aging, the genetic change, which has to happen, has to happen. We need to accept that.
Yeah, Exactly. So that makes sense. That makes complete sense. But you save 10 years of your life, so and the bags get much better. I understand the point.
Of course. Of course.
I get it. Now, what are the side effects of a blepharoplasty?
So see, bruising, swelling is a side effect, but it's not the side effect in the sense it goes hand in hand. It has to happen.
Yeah, that's the downtime.
Yeah, so that's the downtime. Of course, it needs to be done by a good surgeon at a good center to keep it safe. Bleeding, infection, we all fear that with the surgery, and we take more precautions about them than you can even imagine. Ectropion is a side effect which a blepharoplasty can have if not done properly. Many men and women, especially after 50, 55 years of age, they lose the orbicularis tone. So the orbicularis needs to be hitched up on the bone, and a procedure called as canthopexy has to be done, or canthoplasty has to be done. So if someone is learned enough and does this surgery regularly, it's a safe procedure.
Yeah, canthoplasty is also great for those who want the like uplifted eyes, right? When they want this sort of.
Yeah, you can do that, but I think that's an overkill if just you want to change and lift too much.
Yeah, no, I understand. But that's how you know that cat eye has. You use canthoplasty for cat's eye,
Yeah,
right?
yeah, yeah. Yeah.
So yeah, but that's that. So that's and there's new techniques in blepharoplasty now, right? The old time blepharoplasty was different than the new time, correct?
So yeah, so most of the time, or in fact many times, I nowadays use something called as transconjunctival blepharoplasty, in which I do not give any skin incision. Everything is done from inside the eye. So we invert the eyelid and go from inside. So there is no problem to the
Wow.
eye, nothing to be feared, but there is no cut or skin incision made. Now the advantage is it's very quick. Plus, you directly hit the zone where the eye bag is. Hence, the tissue trauma is lesser and the swelling bruising is much lesser. So, Dr. Kiran, how much time does transconj blepharoplasty takes me? 4 minutes
How
by
long?
watch. 4 minutes. Yeah, it's just four
Wow,
minutes. Yeah. So,
that's amazing. Good to know. So I'm gonna send all of my 70-year-old patients with their eye bags to you because I always tell them, I'm like, I can't do much for this. Your eye bags are huge. What
but
do I do?
mind
No,
you,
you can't
mind
use.
you, in a 70-year-old, they may not only need an eye bag removal, they may also need something to tighten the skin as well.
Yeah, that makes sense. But still,
Yeah.
I always, whenever I see a 70-year-old, 60-year-old with those severe eye bags, I know that I'm limited. So I usually refer to you, frankly. And then
Yeah.
everyone is saying,
Thank you.
good that you're explaining this so people understand because I always want the best result, for my patient, and I have to let them know
Yeah.
where they
We
can
all do. Yeah. Yeah.
get. Okay, nose. Now let's talk noses, all right? Now say I have a
Yeah.
hump on my nose, right?
Yeah.
Now, a lot of people think nose job. So I remember when I went to high school, and so I'm born and raised in New York, and I went to high school in New York, right? And everybody at the age of 16 in my high school basically got a nose job. All right, so they would get the nose job over the summer, and then after summer, then all of a sudden their nose was different. And that time, you had to wear the bandage for 4 weeks, and that was a long time ago. I'm an old woman. So
Yeah.
what is it?
It's still a very common procedure in my practice, which we do. Of course, we do a lot of non-surgical noses, as we were discussing, and we can talk about it as well. But it's very common. The only thing which I tell my patients who come to me for noses that do not get fixated that I want that kind of nose, Hrithik Roshan nose, Aishwarya Rai nose. Something which should suit your face should be your goal. You want a better version of your own nose, but a better version which will suit your face. So that's the key. Never do too much in the noses.
100%. So what's the question? So for example, if I see just an issue with a hump and a bridge, then I usually think a filler is fine if someone doesn't want a surgery. But
Yeah.
when is it sure that they should go in for surgery because there's only so much they can do?
So see, the two things. When you ask about hump, if the hump is too much, it becomes too much difficult to add a lot of fillers to
Yeah.
merge it. Plus, even if you do, what you are doing is you are increasing the height of the nose too much, which may
Mm-hmm.
look unnatural. So in
Mm-hmm.
that cases, surgery is better. However, if it's a small hump, you can put some filler on the top, on the below, to nicely camouflage it. And if the patient is happy, it's amazing. It's great because there is hardly any downtime. Walks in, walks out of the clinic. So that's nice. For someone who has a saddle nose, a depressed nose, again fillers can work right nicely because they can raise. But if you want a lot of tip work, tip rotation, there is an obvious deviation, some breathing issues, then surgery is the thing to go.
surgery. And also asymmetry of the nose, right? Surgically, it's always better, right?
Yeah. Yeah.
So then the other thing I wanted to ask you was, all right, so here's my question. Now, what is the downtime of a nose job? Because there's the newer nose jobs where say you're shaving down the hump, then, or whatever it is you guys do. I don't know. You please explain it to me. Then that only takes a week downtime, right? Am I correct?
Yeah, so now the downtime is decreased. There is a concept called as preservation rhinoplasty, in which we
Mhm.
preserve lot of adhesions of the skin to the cartilage, as well as we use technologies like ultrasonic rhinoplasty, in which we use ultrasound tools to break the bones and bring them closer rather than the old chisel and a hammer. Now, the advantage of this is lesser downtime, faster recovery, less swelling and bruising. So that's the advantage. However, most of the cases will have a splint on the nose for a week, but after a week, they are back to go to their social life. Of course, but as in any cosmetic surgery, the best result keeps on happening as the swelling keeps on decreasing up to 6 to 8 months. But they're back to their normal life after a week to 10 days.
But no more bandage on the nose for 4 to 6 weeks anymore, right? Like in
Not
high
at all,
school.
not at all, not at all. That was, you must be talking ages ago. I don't think you look that old, but you must be talking about ages ago.
I am talking about ages ago. I still remember everybody. I like, your nose. They're like, didn't you see me over the summer? I was like, you said that you fell down, and I was like,
Everybody falls down in the summer business at the summer holidays.
it's like, what is this? So,
Yeah.
someone, I don't know what are the average prices for a rhinoplasty? You know, like you're very experienced, Dr. Gupta. You know, I would always go to somebody experienced, guys. Okay, I would always go to the best person who does the most noses. I wouldn't just go to anybody. I wouldn't price shop, by the way, if anyone's here. I wouldn't price shop for Botox, lasers, or surgery. Okay, these are things that I would
I would
never
not
price.
price shop for anything related to health,
Yeah, exactly. I
medical.
wouldn't price. It's all technical stuff that people who know what they're doing and do it all the time. Usually,
Yeah.
you can get the best results when you invest it. In fact, it ends up a cost saving for you in the long term. But in any case, what are the, like, I mean, if you want, you know what I suggest actually? Ishwarana Eshwarya is just contact DM Dr. Gupta, and their office will probably tell you pricing. I think that's
My
best for
website
sure.
has the list. My website has a ballpark estimate for all surgeries. Answering her for rhinoplasty, it has 25 different steps which we can do for every nose. Depending
Oh,
upon which step you need, what you need modifications, we tailor the surgery and hence the cost. It can range anywhere between a lakh of rupees and go up to 3.5 of lakhs. So it's a
yeah.
huge range. Unless I see your nose and understand what work needs to be done, I can't tell you.
Yeah, it's you really need to see somebody, right? In three dimensionality, you know, to really get the makes
Absolutely.
sense. Absolutely. Okay, so that's noses. All right, so when would you tell someone that they shouldn't get a nose job?
When they have unrealistic expectation.
Mm.
Uh, you know, just today afternoon, I got a patient, and he said that he has had a nose job, pretty decent results from somewhere outside Delhi. But he said that he's not happy with his ALA. He wants 2 millimeter from this side and 1.7 millimeter from this side.
What?
And yeah, so it was very precise. And I said that I'm not an expert in this. I can't do you. I tried to explain it, but you see, one has to understand that you may cut the tissues and bring them closer, but how the tissues heal, the tissue elasticity, there is only so much you can predict. You can predict a lot, but each individual is different. And if you're fixated about each millimeter, then that person is not a good candidate for surgery.
That makes sense.
If
And
someone,
understanding the body, right? How much the body is not fully in our control or your control. You know, it's
yes,
all the
yes,
doctor or the patient's control. There's like this range of 10-20% that we just can't
yeah,
predict.
yeah. So, and the other thing is that some people want too drastic a result, totally transformation. Like they will want, so, and sometimes they're so fixated with this Instagram age that they want something like this. And you try to explain them that this will not look good on your face and there is no way you can go back on it because it's surgery. But they would not listen. Then I would refuse them surgery.
That makes sense. I also do the same thing. If I feel like I can't, if I feel like the expectations aren't matching what I believe I can deliver, or if I feel like it's something very artificial looking that's not going to suit them, then I also say the same thing. I also say no. And I always actually would rather somebody wait and think about it before they do it because that really allows them to really firm their mind, you know, and be prepared.
It's it's very important. Never do the surgery the next day after consultation. right? Get
Yeah.
them the consult. We let them go back home, assimilate, think about it, block a date for surgery after a few weeks. Let them keep thinking. It let them come back with more questions, all clear all doubts, and then go for it.
Yeah, because surgery has a whole, like, there's a lot more involved in surgery, right? So that makes sense. So we're already 16 minutes in, Doc. So let's talk breasts now, all right? And then Rohit talk about liposuction after that. Okay. So our next topic is breasts. So non-surgical breast augmentation. I personally have always told my clients that while I can do some lifting, breast augmentation non-surgically, I can't do much. I can do a little bit, but not really much. So I always send them again to you, or they're like, I don't want
Yeah.
surgery. And I'm like, oh, please do it. Or butt augmentation, right? In America, we have Sculptra, where you can actually get a really good response, and it's
Yeah.
more cost effective. In India, we don't have Sculptra, so it becomes really hard, right? Like, so
So
what would you say to these people that want non-surgical breast augmentation? How would you counsel them? What would you explain to them?
I'll tell them it will not work. Neither non-surgical augmentation, and I know you don't believe in this, but I don't think non-surgical lift also works too much. If you want a proper result, you want a, I'm sorry, we can have some difference of opinion, right?
Scared of surgery and you only want like 5 millimeters or a few centimeters difference, no problem. But if you're, I also tell people, if say they're like their sternal to nipple notch, the sternal notch to nipple length is like 40. There's no way I can do anything to you, you know?
Of course, of course. So that's the problem. We need to counsel them that this needs a surgery, and of course, scars are there. So someone has a sagging breast, and they are very scared about the scars. Although the scars of breast lift surgery fade really nicely over a few months, but I tell them, please understand the scars will fade with time, but a sagging breast will not lift with time. So you need to choose what you want. As far as the augmentation is concerned, there are two options: fat grafting and implants. It's too much to discuss on an Insta Live, but it's a great procedure, something which we do it very commonly. We make 10 to 15 breasts every month. So, and it is a very gratifying procedure.
Yeah, it looks so. So, can you breastfeed after breast implants? A lot of people ask
Of
that question.
course, of course, you can breastfeed after breast implant, you can breastfeed after breast lift, you can breastfeed after breast reduction. There is no problem in breastfeeding. It depends upon the surgical technique what is chosen.
Makes sense, absolutely. Okay, so and what's the downtime for a breast lift or a breast augmentation?
In both the cases, it's a daycare surgery. Patient goes back home the same day. They can go for a dinner with their husband or partner the same day evening. So it's very comfortable. No pain, just a tightness kind of feeling. Next day, they're up and about and doing all their activities. They take bath. There is no dressing per se. There's just wear a sports bra for next 6 weeks. Avoid heavy lifting for weights for 6 weeks. That's it. It's a very comfortable surgery.
That's amazing.
We do what we call as a flash recovery breast augmentations.
A
So
lot of their breasts to their husbands. Have you ever met any husbands that were not happy with the breast augmentation?
So don't do these procedures for your husband or partner. Do it for yourself if you want. But I'm just telling you that you can go and celebrate the day in the evening with a dinner as well. So it's that comfortable.
Yeah. No, that's great. That's really great. Okay, so moving on. So Radhika Jane actually asked an interesting question about axillary breasts for.
Yeah, I know her. I know her. We have discussed with her. I've discussed with her. She has a very strong keloidal tendency. If you do an axillary breast resection with a surgery and give a scar, if someone has keloidal tendency, they can develop it. Of course, since we know it, we will do an intralesional tricot after 10 days, 12, 2 weeks, and so on, so that it does not happen. But no surgeon in this world can give you a guarantee it will not happen. We will do our best that it does not happen. But if you have a strong tendency, you will have it. If you have it, you have it.
And no one can give any guarantee, unfortunately.
Yeah.
I we could give a guarantee, we would be God. I could really do with being God, though. I'm not gonna lie. I would love it. I would love if I could do it.
I don't know. I don't think. I still think that I would want someone else to be God and keep guiding me.
Yeah, I wouldn't mind being guided, but then someone should guide me and make sure everything is perfect, and then I never make a mistake and ever
Yeah.
fail.
So, but then life would have been so easy, isn't it?
But life would be easy. I could do with some easy life. I could really do it.
Yeah.
Take a week.
Yeah.
Okay. All right. So let's all body. Okay. Now everyone hears about BBL, lipo, etc. I know so many clients who've gotten great jobs. You how invasive do it and not. I
I'm losing you, Dr. Kiran. I couldn't hear you.
I said, when should you do liposuction? Because I'm coming. Be ready.
Okay. So no, I'm ready. Please come tomorrow. Okay. But someone who has resistant amount of fat, liposuction is good for them. It's not a good procedure for someone who is morbidly obese. For them, you need to go for a bariatric surgery. Liposuction is not a weight loss surgery, it's a body contouring procedure. Weight loss does happen, but to a secondary advantage, a lesser amount. The advantage is if you have certain resistant areas of fat, lower abdominal fat, the flanks, the love handles, maybe the lower back, the brow rolls, submental fat, then it's a great procedure. Something which can turn, a total transformation of your body, give you a nice shape, and it's permanent.
Yeah, that's and so. And what's the side effect profile? It takes some time for the swelling to go down, and it does take some time. But you can go back to work and go back to life, right?
Yeah. If just liposuction and not skin excision procedure or not big areas, depends upon what is the extent of procedure, what all areas of body we are doing. But most of the time, patient goes back to their normal routine by 4 to 5 days. Of course, they'll have some swelling and bruising, which will keep on decreasing. They need to wear compression garments for 4 to 6 weeks. And do some massages, lymphatic drainage massage, which I teach them. But that's about it. It's a reasonably comfortable procedure. And someone asked about the skin loosening. If you do technologies like Vaser and body tight, the skin tightening does happen to a large extent. However, if you have a lot of loose and lax skin to begin with, then probably liposuction is not the procedure only for you. You need a liposuction along with skin excisional procedures, which can be like arm lift, thigh lift, abdominoplasty, tummy tuck, and so on.
You know, I'm coming to you in 10 years, right? Like everything is going to happen. I'm doing it all. I'm lifting everything.
Yeah, book me right now. In 10 years, I might be expensive.
Oh, I know you'll give me a discount. I'm not worried. All right, so it's 7:20. So I want to open up for questions. Does anyone have any other questions before I ask about all of the personal procedures that I would like to do? Anybody's gonna ask
We
me?
have personal procedures on Insta Live, and this is amazing. This is going berserk.
Okay. Oh yeah. So Rohit Kum wants to know about the pain.
About the pain.
Yeah, the pain from procedures. How painful is it?
I can't say it's painless. I can't say it is painful. It's discomfort. After liposuction for first 7 to 10 days, it's the kind of a discomfort which is taken care of by basic painkillers like diclofenac. We usually don't need a stronger painkiller. So most of our patients are comfortable. It's because we use technologies like microwave, Vaser, body tight, and faster recovery.
The liposuction is done with Vaser and you simultaneously do body tight, or how does it work?
So after doing Vaser and suctioning by microwave, I do body tight because it gives an enhanced tightening of skin. So this is combination of technologies. I call it pure liposuction. P means power, U means ultrasound, R means radio frequency enhanced. Pure liposuction, pure contouring.
That's very nice. And does it prevent that risk of cellulite afterwards? Because remember we had all that cases of like that Tara Reid, she got lipo and she had all that weird cellulite on her tummy. You know, like what was all of that all about?
Cellulite is dermal deposition of fat. Liposuction will not do cellulite. You would have been having cellulite, but they become more prominent after the liposuction because you have removed all that other fat. Plus, if your skin is loose, that becomes much more apparent later on. So if you had loose skin to begin with, then you need a skin excisional procedures at the same time.
Okay, I'm doing it all. Be ready. You're going to have so much of my skin sitting in It'll be all right.
So people, next time you don't get appointment from Dr. Kiran, her staff says that she's out of office, her appointment is not available. Basically, she's in my hospital.
Probably. Okay. Last question. Scars. Now, how long? Now, scars are something I treat, right? But how long did the scars last?
So no scars goes completely away. They fade, and they fade really nicely if properly treated. So in liposuction, especially, the scars are anyways 3 to 4 millimeter, and they're hidden, so they are never an issue. In breast lift or breast reduction, where the scars are like a lollipop scar, that also fade really nicely. For a breast implant or breast augmentation, scars are again hidden on the undersurface of the breast. Nobody can see the scar, even a woman is standing naked. And it's an area where the scar fades really nicely if proper care is taken care of.
Okay, and the last question we're gonna do by Nautanki_much. What a great handle, by the way. I love the name. Okay, how getting breast augmentation? There's a lot of extreme cases of breast surgery.
I don't know where they come up. They have not come into my office though. It's a safe procedure if done properly by a good surgeon at a good center using good augmentation techniques. Good CE approved, FDA approved implants, no Chinese or Korean implants. Nothing against China or Korea though, no politics, but just the quality of implants.
Okay.
So people get offended these days about everything.
Huh?
People can get offended these days about anything and everything, isn't it?
I know. Disclaim. I'm disclaim. That's it. I just said it. Okay, we're covered. All right, Doc. It was a pleasure with you. Thank you so much. You answered a lot of my questions. I think you answered a lot of everyone's questions here. I'm sure you're going to save this live. For those of you that want to learn more about plastic surgery, yeah, Gupta. And if you want to learn about non-invasive, yeah, we both work together in multiple cases. So we know together and coordinate to give you the best result. That's it.
Thank you. Lovely talking to you. It was really nice and funny.
Nice and fun, right? Okay, good. Take care.
Bye-bye. Take care.
Bye.